And tonight I have some of my nurse colleagues who will be speaking to us about the situations that I have been talking about in the nursing profession. So there are four nurses, including myself, and we're going to be going live in speaking about what nurses can do to move forward. I want to speak with Nurse Sherry. Can you please give us some update about what you have been experiencing or what you have heard about some of our nursing colleagues in the profession? Sherry?
Um, yeah, a lot of the nurses, they are placed on these lists where they can't work, and they're systematically placed on these lists. And it's been going on since at least 2010, and we haven't been able to get any help to push our case forward with the EEOC.
Right.
The nurses they're fully licensed and accredited and excellent nurses, they're being placed on these lists, and as the hospital merges together, uh, if you're on one list, you can't work for the whole healthcare system. And since it's been going on for since 2010, a lot of the nurses are no longer able to work in the hospital because they're trying to tell you that you have to have a year recent hospital experience in order to work. So it's like your license are basically not any good for the hospitals, even though you've had 35, 40 years of experience. And we've basically been pushed out of the hospitals
Wow.
successfully.
Wow. How long has this been happening? Can you share
It's been
that?
happening since it's been happening at least since 2010.
2010. Yeah, that's about the same time I noticed that it started. I remember back then
And
there were a lot of nurses. And I think you were one of the nurses that I had met around that time, Sharon. We have
yeah,
crossed paths several times since
yeah, we
2010.
are systematically being targeted as Black nurses. Um, Systematic. It's a systematic. You can go to work credential. So I'm certified. I
Hmm.
was certified in critical care emergency room, fully credentialed, and you can go to work and somebody could just claim that you don't know how to give blood or you don't know how to check a blood pressure, and basically you're out of there with no due process um, at all.
And it's not true. So they've actually fabricated stories against many of the black nurses.
And they're
Um,
violating not only our civil rights, but they're violating our constitutional rights as well. And we have not been able to reach out, find an attorney. These
yes,
lists, they were putting them in books, but now they've gone to putting you in a database and keeping you from successfully keeping you from working.
they have
I know
centralized.
nurses. I know nurses right now that
Hmm.
have children that's homeless and sleeping in their cars, even
Yes,
though there's even
yes.
though there's supposed to be a shortage of nurses.
It is happening right now. I just spoke yesterday, spoke with another nurse that I was told that that nurse was let go from her assignment. She's a black nurse. And a day later, she lost her apartment. And 2 days later, she lost her transportation, her car. So
Wow.
it's real. This was just yesterday.
Mm.
So yeah, Sherry, I see what you're saying. It is true. It's been happening since 2010. Is there anything else you just want to throw in there, Sharon?
Uh, no, that's it.
That's basically
That's
it.
about all. We just have to, I guess, continue to push on, pray, and push on, and maybe, hopefully someone will
Something will be
some
done.
help will arrive to address this and investigate this situation that's going on. It's basically it's nationwide, but it's really bad in California and Arizona and on the East Coast as well.
Mm-hmm. Yes. Yes. All right. So what have you done, Sherry, um, to actually help a nurse, or if this is, I know this has happened to you, what are some of the things that you have done to change?
The help nurses.
to help to change the situation at hand with the nursing profession.
Um, well, basically, I just steered the nurses toward maybe going into jobs outside of the hospital, like case management jobs, and referred them for case management jobs that's
Right.
outside of the hospital.
Right. But some of the problems I find is that when you try to bridge to another area, if you don't have the experience, you might not get that job. So that's one of the
And
issues.
on top of it, they're not giving us referrals, references in order to continue on with your career. You need references from charge nurses, and a lot of the charge nurses are the ones that are writing us up. You don't have hardly any African American charge nurses. They have a lot of the H1B1 nurses from the Philippines that's in charge, mostly, especially in Los Angeles. And they're just putting you on a list, and there's the nepotism because a lot of them have their whole family working in the hospital, and they basically don't want to work with us. They rather work with their own people, even though they're working in a community hospital where we are part of the community.
Unbelievable. Um, Thank you so much for giving us that report. And we have another nurse by the name of Nurse V. Nurse V, welcome. Can you share with us anything that you have experienced in the profession that has affected you over the years? Nurse V, are you there?
Oh, yes, I'm here.
All right.
Hi.
Yeah, please share
Hi.
with us some of the
Yes.
things that you have experienced or
Yes.
seen.
Yes, I've been impacted. Um, when I first came to travel nursing, it opened my eyes as to see the difference in treatment and making assignments, and how the work culture in the hospital is not really friendly like it used to be. It's in a way hostile, and you let things go and you just keep on going and keep going, and at the end of the day or at the end of the week, you be in your assignment, like 2 weeks later, next thing you're getting the call, your contract is being canceled. And lots of times they don't even tell you why. And I find that very disturbing.
Yes.
You know,
it is.
And I was just devastated. You know, and so then they don't give no due process as to what Sherry has said, and I find that really appalling. You know, if you're doing something wrong, they should have enough courage to let you know, but that's not the deal in case right now.
Right.
It's just like you don't have to do anything. You can just show up and they see who you are. They size you up and they already made up in their mind, and you can tell when the eyes are on you. And this has been going on for several years. And I had worked in acute care for many years, and I even went back to school to meet the requirement. You know, I went back to school and got my BSN, my degree. You know, and what's to have a BSN when you can't really utilize it?
That's right. That's right.
And
it's not only devastating. It's devastated. It's traumatic. It's traumatic.
It's very traumatic. It's very traumatic, and people are looking at you. You're not working again. I said, and you know what? But I think the public really, I think some of the public is really noticing. It's like, what happened to the Black nurses?
Yeah, and I might say, I'm sorry to cut you, but I might say, as you bring that point up, is that from what I have seen, it's only the Black nurses that are experiencing this.
Yeah, because you see everybody else, but you don't see too many Caucasian nurses. Not that many, depending on what area you're in,
that you're working in,
depending on the demographics of the area where the hospital is located. Now, it doesn't make sense to me when you're in the central area location where the demographics are mostly African American population,
In the
and you see a
community,
bunch of other cultures in there, you don't see people of your own peers,
taking care of the
and
patients, right?
and that's very disturbing to me.
Yeah,
And they talk about cultural diversity.
that's right.
What is cultural diversity?
Yeah.
And so I'm like, they're not even upholding that. And the state boards
Yep.
throughout the United States, I know California and other states, I believe Oregon and other states,
Mm-hmm.
they want people to take these courses when they first get in nursing.
Yeah. Yeah.
And I'm like, what have they learned? It's just getting worse.
Yeah. They're not carrying through their own policies.
No, they're not. And I just find this as a travesty. And also, when you're on the job, you go through compliance. They time and time again every year. They put that culture diversity training in there. They even got they got cultural bias now out there now that
Yeah.
people have some credit to take.
Yeah.
They have them. And it's like, okay, where are we going with this? They're not following the rules.
What is it for?
Yeah. What's it for?
Yeah.
They might just not even bother with it because they're not following to do.
Yeah.
And I find this. I think what it is, the people who's being cared for by the hospitals, maybe, and the patients need to start asking, what happened to the Black nurses? I don't see many. I just see all this one culture and nobody else. So,
Yes.
as a patient, I be wondering what's going on, because every time I step forth in a hospital where I'm visiting a loved one in a hospital or a friend, I be looking, scoping out the land to see what's the atmosphere and the culture of the hospital. And if I don't see nobody in my peers, I say, maybe I just don't look at that one floor. I got to be looking at everywhere. I'll be taking notice. And I say, and I say, what's going on?
That's
but
right.
I think the important is awareness and what can we do.
That's right.
I know through the years, as I have known you, Donna, that
Yeah.
no attorneys don't want to take the case. The EOC has failed us
Yes. Yes.
in hearing our voices and everything as to what's going on. It seems like they just like got the head in the sand.
And they have these books out here, these DNR books, and I don't know why the Attorney General or the Department of Justice or the EEOC cannot go in and
Look at the books.
compel them to produce these books, because these books are, I've seen the books, and the books is mostly African American nurses that's in this book.
Yes.
And they're being placed in the book for Jim Crow reasons, oh, you didn't take a lunch break, or a patient had a complaint about you.
Right.
You had on purple shoes, whatever.
And then you end up
then you're out of your livelihood, you're out of your job, even though you're a professional and have met, it doesn't matter.
That's right. You end up on this list without any.
If a Becky or a Melda have a problem or an issue, whether it's a valid issue, you're out of it, because you're just off your job.
Right.
Your livelihood is it's gone. You can't feed your family. You can't, pay your bills. You're just basically out of there, unemployed, and you cannot get a reference to go on and take another job.
Right, right. So, this problem is severe. There are nurses, and I think you have heard about a nurse who has developed PTSD syndrome because of this kind of treatment to the Black nurses in the profession, where they have had to leave and seek psychiatric care. And so,
not to mention the nurses out there who are not even licensed. They do not even have a license, but they have the color for the connection, and they basically have worked in hospitals. In fact, there was a nurse in Florida who had cared for 4,000 patients, and she wasn't even licensed.
Yeah.
And she was up for promotion and everything else on her job. In fact, that healthcare system where she worked in is one of the healthcare systems that terminated me and claimed that I didn't know how to give a blood transfusion.
Right.
And I've been a nurse for 35 years in ICU, recovery room, surgery, different places. I've worked in various areas. And just because of Becky said I didn't know how to give blood, I'm basically was let go.
Yeah, without due process too. You basically let go without having a say about it, whether that has happened. And I would say in 100% of the case, nothing happened. They willfully, intentionally put you on these lists and actually blacklist you throughout the whole system. And it's illegal. It is really illegal. So we're trying to build the awareness so that the public can be aware of what we are still going through. Thank you so much, Nurse Sherry, for that report. We have our next nurse is Nurse Sabine. And Nurse Sabine, she is a practitioner, a trained practitioner where she has had obstacles also, but she has moved on to start her own practice. Go ahead, Miss Sabine, welcome. Hi, Miss Sabine, are you there? Miss Sabine? Okay. Okay, while we try to get a hold of her, I am going to ask Miss Nurse Linda, do you want to say anything? Nurse Linda? Okay, I'm not sure what's going on here.
Okay, here, I'll tell you, but I
Go ahead,
really
Miss
don't have
Linda.
a whole lot I want to say really about that. Just want to just listen to what's going on right now because it's just it's been a problem. What are we going to say? What can you really say?
What can you
right
really
now?
say? We just
There's
want to
nothing
build.
much that you can say right now
Yeah.
when you cannot get nothing, no jobs or anything. What's the deal? What's the situation?
We
What
want
are you
to.
gonna say?
We have to build awareness, and we just want you as a witness to attest to the fact that we are experiencing real, I would say, I call it discrimination in the profession. But thank you so
Well,
much, Miss.
That's what it is. That's what it is. But it's like California, period. California is racist, period.
And
this is a state, like this state. So there's no whether for the person or whatever. It's the state.
Yes. Thank you so much.
Okay,
Thank you so much for that report, Nurse Linda. Miss Sabine, are you back with us? Go ahead, Miss Sabine. I see that you're here. Miss Sabine? Hey, Miss Sabine, are you there? Okay. Okay. I am actually doing a troubleshooting here. In the meantime, RV, can you please give us some information about one nurse who experienced PTSD? Because we were talking about that early. Miss V, are you there?
Yeah.
Okay. All right, Miss Sabine, are you back?
Yes, I am.
Okay, Miss Sabine, welcome. Go ahead, please.
Welcome, I'm Sabine. I'm a nurse. I still work sometime in the emergency room, but I also a nurse practitioner, and I have a clinic in Bethesda, Maryland.
And how did you start that as a practitioner? What made you go back to school to earn that degree? Tell us a little bit about your nursing experience.
So my nursing experience, I started working as a nurse in the 90s, late 90s, and
Mm-hmm.
then in early 2000, I started working as a travel nurse.
Mm-hmm.
And then I ended up being in California around 2006 as a travel nurse. When I went there, everything started very well.
Mm-hmm.
And then from continuing to work in California, and then I started getting into some obstacle while I was there.
Mm-hmm.
So a lot of time I would go to work, you would get canceled sometime, or they would start making you, oh, you could not go back to the hospital. There wasn't any explanation why you could not go back to the hospital.
Mm-hmm.
So they just make you on the list of a do not return. So
Yeah, they yeah, they just put you on a list and tell you
a
you
lot
can't
of
go back.
hospitals, so you could not really feel it at the beginning.
Mm-hmm.
But the list start growing, so you start feeling how hard it was as a nurse to work.
Mm-hmm.
And then from working for also in service centers, so that's why I got inspired. So with different type of nursing, so
Mm-hmm.
that really encouraged me to go back and get my master's.
Okay. So tell us, you believe that you are able to bring some nurses along into what you're doing. Can you tell us how, tell us about that wellness clinic that
So
you're saying?
my what I like about the clinic that I opened, it's
Mm-hmm.
also about primary care, but mostly focused on wellness.
Mm-hmm.
So what I mean by wellness, for example, like if somebody needs a wellness physical, for example, like when we go to work for the as a pre-employment,
Right.
so that's the wellness physical. So the agency in general, they want to make sure
Mm-hmm.
you are qualified
Okay.
to provide care to the
To
patient
patients,
when you
yes.
go to work at the hospital. So they
Mm-hmm.
want to make sure you can live. They want to make sure you can bend. So like in general, now you are healthy enough to to work. So
Mm-hmm.
I do that, and also
That's
like
good.
people need skincare. I also do skincare. I
Skin.
can prescribe treatment for skincare,
Mm-hmm.
and also I do hair restoration.
Oh, fantastic. What kind of wellness would you call that? You
What you
said
said again?
wellness. What kind of wellness? Would that is that generative you did say earlier?
So wellness is in general like it's just a term. So we use wellness in terms of preventive.
Preventive. Okay. Mm-hmm.
Yeah, it kind of prevent certain things. So because sometimes like it's like you go to see your primary care, but it's something very more critical. So that's when I will tell you like, oh, you have to go and see a specialist for this.
That's good. Okay. And
So
how
for
long?
example, if I'm treating you for your scalp, so I
Mm-hmm.
will do the assessment. If you need a biopsy, I
Mm-hmm.
will. It's when if the client I feel comfortable for me to like in general, like we go to the emergency room for something minor,
Oh, okay. Mm-hmm. It's like
and
a.
then
I'm
I'll
sorry.
use this
Mm-hmm.
and then if you want to do a biopsy, you can do biopsy, or you can either start the treatment, and
Mm-hmm.
there are some vitamin supplements sometimes you can take.
Mm-hmm.
So things like that. They also incorporate like pain management also in that.
Pain management. So you're actually saying that as RNs that we can move forward, not necessarily depending on the typical hospitals, and especially in this current season where we have cut in Medi-Cal and or Medicaid and Medicare, where cost is going to be an issue. And you're saying, how do you think that will impact the population of patients out there? This kind of nursing.
In terms of Medicare and Medicaid,
Mm-hmm.
as you can see, the government doesn't really pay for preventive treatment.
Mm.
So even when you have insurance, So when you go to see, they require you to go and see your primary care every year.
Right.
Sometimes they ask some tests. Sometimes people need deeper, so
Mm-hmm.
sometimes they have to pay for it
Mm-hmm. Mm-hmm.
because there are a lot of things. When people hear about wellness, wellness is something that you want to make sure that you are healthy.
You want to make sure you're healthy. Yeah.
Because a lot of people they're waiting until they have the symptoms to go and treat something.
Yeah, which is not the best time. The best time is for people out there, patients. Before you become a patient, it's good to get a checkup. A nurse can do that for you at a
Yes.
lower cost.
So my goal on my treatment, I offer a lower cost
Mm-hmm.
for people who doesn't have insurance, or sometimes even people have insurance. So when you see the copay,
Yeah.
most of the copay lately is on 150. I remember years ago when you go to Kaiser, when I used to work at Kaiser,
Mm-hmm.
the copay was like $50. I think the copay is much higher now.
It's much higher now. Mm-hmm.
So healthcare is become more
It's
expensive.
costly. Yeah.
And even people are paying insurance, but the copay is still high. So sometimes I just charge people at the price for the copay. And if people have lab,
Mm-hmm.
you want to go and use your own lab, I let people use their own lab form if they have insurance.
Mm-hmm.
They don't come into lab at my place. But if people want lab,
Mm-hmm.
I also charge them a lower price because I work with LabCo and LabQuest.
Okay. Fantastic. As I have shared in the past that I work as a skilled nurse in the emergency room and in the ICU. That's my specialty area. But because of the blacklisting, it's been very difficult to maintain my skills, and it would be great to connect with someone like Sabine. What about any of the nurses here, Miss Sherry or Miss V? Can you, any questions for, uh, any question for Sabine? Sharon, any questions for Sabine? What about you, Nurse V?
Yes, I have a question.
Okay, go ahead.
Um, how did you happen to get started? So you have a pretty, the clientele is a lot of people coming, or you just work alone, or you have a whole clinic staff working under you?
Mm-hmm.
Now, so far, the clinic is very small. I studied alone. It's by myself because it's not growing as fast because I just started.
Mm-hmm.
Because I'm in the Maryland area, so I choose Maryland.
Mm-hmm.
So that because I could work independently in
Independently.
Maryland as a nurse practitioner.
Good. Very good.
But when the clinics start growing, definitely I will have to hire people to help.
Also, Miss Sabine, you talked about branching out to some of these other states that we have nurses that aren't being hired by the medical centers with very, very skilled experience, very skilled nurses. How can you paint a picture? How does that look?
Okay, so what I was set on in terms of nurses, so like for nurses who's having a lot of a hard time working as a bedside,
Yeah.
and they have a lot of experience, I think it would be a good idea for those nurses to use the skill that they already have from the acute care setting and try to go on their own
Right.
and as a private sector to really help their community.
Wow, I like that. I like that.
So, like for example, if you do mothers and babies, and then you are very good at it, so you can do private services in your community,
Right.
and then charge the patient because a lot of people they discharge them early lately. A lot of people don't know what to do. So nurses they could charge because as a nurse, most of the time the patient end up in our hand.
Yeah.
So there are a lot of things we could teach people in our community by using our skill from what we learn.
That's
If
great.
somebody's good at doing diabetic teaching,
Mm-hmm.
a lot of people have high blood pressure and diabetes. It's a
Mm-hmm.
good way for nurses to really incorporate that, to teach people about nutrition,
Mm-hmm.
about how to take the medication, how
Right.
important it is.
Okay.
Because when we work in the ER, we see a lot of people are coming with blood pressure medication.
Yeah.
They don't even know
They
why
don't
they're
know.
on medication.
Yeah. They don't know
They
what the
don't even
med's
take
for.
the medicine.
Yeah. So there's
So
a
it's
lot of teaching.
educated
Yeah.
about the reason why they put them on the medication,
Mm-hmm.
and also diet, exercise.
Right.
It's not like when they come and they are losing their feet. Like you see, Donna, you work in the ER, you see a lot of young people in their early 50s. They
Yeah.
come into the ER, they are cutting their feet. That's
Yeah.
because of diabetes and high blood pressure.
Mm-hmm.
People are going on dialysis. What's the
Yeah.
number one cause people go on dialysis?
Yeah. Diabetes,
Diabetes and
hypertension.
high blood pressure.
Yeah. So there's a lot of teachings that's needed, and we're going to come together to begin to do some of these work. I think presently, what I'm learning from the new laws that are being passed by this administration is they don't want to spend a lot on healthcare, and they're cutting costs. Rather, they're cutting the fundings that have been allotted to these hospitals in the past. And
No, but a lot of people are spending money on healthcare. Like when you go to those wellness places,
yeah,
insurance doesn't cover that. It's people who are paying cash
pay, wow.
for all the services.
Yeah, okay, okay, wow.
Even when you go to Concentra, a lot of people who go and have physical at
They're
Concentra,
paying
it's
out of pocket.
work related.
Mm-hmm.
The people
Paying
they
out of
pay for
pocket.
their services.
I see. Okay, very good, very good. You know what? I tell you, I this is new, a little bit new to me because I've always been a nurse where I have to work with a hospital. So kind of like the independence thing here. And I think there's so many of us that are in a position where we can go out there and do some independent work. And we trust Sabine that we're going to connect with you a little bit more to see how we can come together and work together. And if there's anyone out listening to us right now and you're interested, Sabine, do you have a website?
I have a website. It's called Pain and Healing Wellness Center. It's Pain HWC.
It's called www.pain,
Not Pain HWC.
not pain, did you say, or pain
Pain
H?
PAIN HWC.
Okay, so I'm sorry. Her website is painhwc.com.
Yes.
Okay. So if you want to get in touch with Sabine, please log on to www.painhwc.com.
I strongly encourage us to get involved in something that we love to do,
What's that?
because we're having so much hard time at the bedside, and then most of us are overqualified. And most of the young nurses, that's why they don't stay at the bedside. You see them, they open their business.
Yeah.
And then us, we still are struggling and want to do like hospital. Nursing in general, it's not only hospital, it's everywhere.
There's so much need across the board.
Everywhere you work, you need a nurse.
Everywhere everywhere in your area, wherever you're located, there's a need for nurse. How can we go out? How can we promote that kind of nursing, though?
No, but the profession is already there. You just have to dip into it, and then you start on by you starting on by open an LLC, and then you get all your information, and then some people do concierge nursing.
Okay,
So that's
very
why
good.
tonight, where I really want to join us, is to encourage each other to start doing things we love to do.
Okay.
So like there is a nurse in Europe. All she does is she doesn't only treat hair.
Okay.
She doesn't do anything else.
Wow. Very good.
Yeah,
Very
she treats
good.
the scalp.
Yeah,
So
nursing.
we're not esthetician. We're not gonna go there. We're not gonna do lashes. We're doing like a real treatment.
Mm-hmm.
Because don't forget your scalp is the skin also. You need to treat on the scalp.
Yeah, yeah.
So there are treatment for that.
Gotcha.
So when people hear about wellness, so we're not talking about Botox. We're not talking about like laser. Even in the laser, the Botox is part of it. Because some people have skin issues. There are lasers who really treat the skin.
Mm-hmm. Mm-hmm.
So
Okay.
the same way you wear the wig, so that the same way when the scalp needs to still be
The scalp,
treated.
yeah, the scalp needs to be cared
So it's
for.
the specialty for that.
Okay.
It's not only the people who do trichology who does that. There are nurses who focus only on treating the scalp.
Okay, do you do any consultation? Because I'm sure our nurses would love to come and talk with you, and where we could learn a little bit more about the wellness, health and wellness
Yeah, I
business.
want you guys to leave the bedside behind because we're having too much difficulty. And then
Yes.
at our age, we
Mm-hmm.
won't still want to work. We have a long way.
To become
We are
independent.
still very healthy. We
Mm-hmm.
still have another 20, 30 years to work.
Yes,
So don't
yes.
say you're going to retire
That's right. That's right.
because the community need us. We
That's
need each
right.
other.
Yeah.
And then we are well experienced nurses.
Mm-hmm. Yeah, as many of you know, I started a staffing agency in 2018 because I love healthcare and I love to promote health. And one of the ways that I think I thought I could just jump into is to help to get nurses to various locations. So that's my forte. So I'm sure that I'm gonna be talking with you, Sabine, to see, to add something else to what I presently do.
So ask the other nurses, what are they good at? What type of nursing do they do at the bedside?
Yeah. So, Sharon, can you give us an idea of what do you do right now? What kind
Well,
of nursing you
I
do?
haven't worked at the bedside in about 7 years.
Mhm. Okay.
Before I worked at, before what I'm doing now,
Mm-hmm.
I worked in the intensive care unit, in the emergency room,
Mm-hmm.
triaging, assessing patients,
Yes.
and maintaining their condition, like after heart attacks and strokes. And I did rapid response. I was a rapid response nurse and
Mm-hmm.
responded to emergency codes and stuff like
Mm,
that.
wow. Wow. Very
And
high tech. Mm-hmm.
yeah, all areas.
Yeah.
Coronary care, open heart surgery,
Mm-hmm.
recovery.
Wow. And
With all that experience, it's like the hospitals in my area, they're short of nurses, but I cannot work at any of the hospitals in my area because I've been put on do not hire list.
unbelievable.
So that's why you use that negativity to turn it into your own business.
Positive. Yes.
So our goal tonight,
Mm-hmm.
so we want to support each other. Anything you would like to do in the future, we want to open a dialogue where we can support each other. You know, like when they said, like, okay, we're going to
Mm-hmm.
boycott Walmart. We don't want to boycott anything. We
Mm-hmm.
just want to support each other. Nurses, we have enough nurses, enough people in healthcare
Yeah.
to really support each other.
Definitely. We're going to
So, like,
support each other.
if I know,
Yeah.
like, for example, I'm in Maryland. If you know people who need my type of service in Maryland, you refer them to me. If you're in Georgia, I know people who need your services. Like Donna said, she's doing the agency. So we want to help her. We can go and work for her as the agency.
Mm-hmm.
So we're supporting each other.
Yeah, as a matter of fact, that was my intention that I would get 10 nurses and we would partner up and we would each run our own staffing agency. And that offer is still open to anyone who is willing to connect with me. And my email or my website is D like David, M F like Frank, nursing registry.us. So, feel free to connect with me. Feel free to check the website out. I would love to consult with you. Um, anyone else?
So what anybody else would like to do, because we're here to support each other.
Yeah. Nurse V, what about you?
Well, what I like to do, what I catch myself, what I've been doing, and I'm in transitioning to find something else and getting direction,
Mm-hmm.
and I like to advocate. I like advocates, doing a lot of advocacy for people on behalf of those who can't really
Okay.
speak for themselves, and they don't know how to navigate through the system and how to get the services or asking the vital questions they need to ask of their doctors, or guiding them through, or being there, and explaining things as to the type of care and what the needs, and to see them through to get the services that they need. And
Right.
so I find myself doing that right now,
Mm-hmm.
and I believe I want to pursue that more, and I'm already involved in working in the
Community.
community
Right.
right now. So I
Charge
think I'm
them for
expect,
that, for the service?
Very good.
yeah. Pardon me?
Are you going to charge them for the service?
Yeah, I'm gonna look into it further, and everything, because I was in charge, because I was just doing it among family and friends and people that come across, and sometimes I get referral from other people, to see and direct and things
So
like
kind of
that.
like a nurse consultant.
Yes,
Also
yes.
consulting. Right.
So don't forget you went to school for that. Don't try to give people your service for free, because
Right, right. That's what a lot of people telling me, but
Yeah,
I.
definitely not.
knowledge, so
Mhm.
don't give your what you know for free.
For free.
So the goal tonight is to encourage each other to start a business. It's not gonna be easy,
Right.
but at the same time we can start from somewhere. And we're
Yes.
gonna
Yeah.
be there to support each other.
Right, right.
Thank you so much.
You're
Well,
welcome.
you know what? This is a great time to end, and I want to thank each and every one of my guests tonight for coming out to support me, and to my viewers and subscribers. Thank you so much for connecting. I want everyone to remember to subscribe. Hit that button. Subscribe for more. God bless you. You have a good one. Take care.
Thank